Now, direct payment at point of use is the least optimal way of financing healthcare, as in poor countries in particular, dramatic and expensive ailments can push the poor into bankruptcy, or else high costs can dissuade people from seeking desperately needed medical care. Joining us now to discuss what trends will make a difference to healthcare in Africa is Jelko van der Avot. He's a manager at KPMG's Healthcare Advisory. Thank you so much for making the time to join us. Let's start off with the broad picture. How has the economic crisis in developed countries impacted on healthcare trends in Africa?
Thank you, Nozipo. That is a big question to start off with. I'm not sure if that's an easy yes or no question,
right.
But I think it is impacting. Obviously, many governments in Africa still depend on funds coming through from developed countries, whether that be via foundations like the Bill and Melinda Gates Foundation or government, European Union or US aid funds. I don't think that has dried up, and I think it is still needed in the upcoming years actually to countervail that what you just mentioned. You don't want patients paying at the point of service. You want patients enrolling in a prepaid, pooled type of environment in order for them to have access to healthcare.
So are we seeing a general upward trend in terms of the cost of accessing healthcare in Africa?
I'm not sure about that. There's a global trend in terms of healthcare costs will always rise because of medical technology and inflation, etc. And that is true for Africa as well. I think the diseases treated in Africa are slightly different than those from the developed world, and I think that's important to keep in mind. In Africa, focus is on communicable diseases instead of non-communicable diseases. Well, that is very likely to change in future, not near future, but in future. So the type of equipment and the type of resources you would need for that is slightly different.
Let's look at national health schemes, understanding that we've got some on the continent already, and we have a phenomenal one in terms of its ability to increase access in Rwanda and Uganda. What are some of the lessons that South Africa in particular, who is on the path towards an NHI, can take up from there?
Sure. Well, Rwanda specifically, you mentioned it, has been very successful. I think more than 90% of their population is now on an insurance scheme. I think the lessons learned is that they start off with tying the schemes, the health insurance packages, to a health center. So they had many small health insurance companies tied back to health centers, and they basically trained the population how insurance worked, which is very important. The communication around that is very important. Specifically in Rwanda, there was a huge political will as well, entrenched in all levels of government, and that has made them very successful. Their leadership, the starting off small with microinsurance, backed up by national government, and the political will to make it happen.
How did they get the financing model right, so that there's also, in addition to the political will, a buy-in from the people who might have to contribute through their taxes to the scheme?
Yeah. So one important thing that Rwanda did is that there was a flat rate for families to join. So the larger the family, and research has shown that the larger the family, the more likely people were to join. Obviously, your rate per person then goes down.
Right.
Another thing is that the government had, I just need to speak here, a National Guarantee Fund and a District Solidarity Fund.
Okay.
So if microinsurance didn't really work because the risk pool was too small, and basically if you have two bad cases, so two people that need severe healthcare, that can wipe out a microinsurance, but that was backed up by those funds, and foreign donors invested in those funds together with government. And I think that is something that is critical, and that has made Rwanda very successful on their journey.
Is there any particular reason why South Africa can't pick up this model and maybe with a few tweaks actually implement it here? Well,
the difference is that South Africa is not developed, is not seen as a developing country, right, by the US and the European Union. South Africa is relatively rich, of course, if you compare it to other African countries. So the government needs to pull it together themselves. What government can learn from it is that there are successful countries in Africa. So what has happened there? Establish a national health insurance fund. I think that's one of the pillars that is spoken about in NHI. But also think about what is the point of delivery of healthcare. Is that in a very expensive hospital setting, or is that primary healthcare? Government is investing in primary healthcare, and I think that is a key component. Primary healthcare is typically cheaper because it's delivered by nurses and not necessarily always by doctors. So it's not only how do you establish that financing mechanism, but also what does your care delivery process look like.
Before I let you go, of course, one of the key issues in healthcare in Africa Africa has always been the brain drain, where we see the skilled capacity going for greener pastures in Europe and other parts of the world. Are we turning the corner on this front?
It depends. There are certain mechanisms one can put in place. I think you need to upskill the nurses and give them certain degrees of freedom in terms of prescribing medication and running primary health care. That would also allow doctors then to work on top of their skills. In every job you want to work on top of your skill. So if you give nurses more responsibilities, the doctors can then look at what they call the interesting cases.
Right.
And that would, I think that is one of the arguments to keep them on the continent.
Very quickly, I've got a minute left, and I want to look at the trend where we see private sector almost mopping up the skills that you get in the public sector hospital schemes. Are we seeing greater collaboration? Because for me it seems that that's the only answer of actually getting a win-win situation out of this.
True, you're right. I think where we see a win-win situation in other African countries, for example in Lesotho, where there's a huge public-private partnership between a private hospital group and the government of Lesotho. And they basically staff the hospital, they clinically staff the hospital, and they have the nurses going on training in some of their private hospitals in South Africa. So I think that is a means of upskilling a workforce in public sector.